Inguinal hernia. Hernia is a condition in which a part of an organ displaces and protrudes through the wall of the cavity containing it. Thus, various organs can protrude through various regions of the body if it is displaced. This displacement can be seen or felt by the person easily. When it comes to inguinal hernia, it basically means protrusion of an organ through the inguinal canal. The inguinal canals are the two passages in the lower segment of the abdominal wall near the groin, which in males convey the spermatic cords and in females the round ligament of uterus. A displaced part of small intestine or in females a part of the female reproductive tract like the ovaries have the ability to herniate or protrude through this inguinal canal. Coming to the causes of inguinal hernia occurs mainly due to two reasons. The first being a weak spot in the inguinal area where the muscles have weakened, and the second being an increased abdominal pressure. Both of these causes hernia as the muscles of the abdomen is too weak to push or hold the displaced or protruding organ in place. That is why some hernias can easily be pushed back with the fingers. If the wall is not pressing against the intestine or other organs as it should, then those organs are bound to fall out of place and cause an abnormal protrusion. Sometimes the inguinal hernia is caused due to a persistent opening that does not close during fetal development. Thus, inguinal hernias which occur due to this structural deformity is called as indirect inguinal hernia, while age-related hernia and hernia due to weakened muscles is called as direct hernia. Some of the risk factors associated with this hernia are: it is more common in males than females, older age group due to muscle weakness, premature infants, family history of hernia, chronic constipation, obesity, chronic cough, cystic fibrosis, pregnancy, straining, vascular defective collagen synthesis, smoking, heavy lifting, and congenital connective tissue disorders. Now, there are many types of inguinal hernia and they are categorized based on different features. According to the extent of inguinal hernia, it is divided into bubonocele, incomplete inguinal hernia, and complete inguinal hernia. According to site of exit, it is divided into indirect hernia or direct hernia. According to its contents, it is divided into enterocele, omentocele, and cystocele. The clinical types of inguinal hernia can be categorized as reducible, irreducible, obstructed or incarcerated, strangulated, and inflamed. According to the extent of inguinal hernia, the bubonocele hernia is an indirect type of a hernia in which the hernial sac stops within the inguinal canal after entering internal ring. In incomplete inguinal hernia, the hernial sac is confined only to the inguinal canal. In complete hernia, it is where the hernial sac transverses to the bottom of the scrotum and protrudes below the inguinal canal. According to the site of exit, indirect inguinal hernias are caused by a defect in the abdominal wall that will typically have been present since birth. The direct inguinal hernia is a type of a hernia usually occurring in adult males due to weakness in the muscles of the abdominal wall that develops over time or are due to straining or heavy lifting. According to the contents of the hernia, It is divided into enterocele, omentocele, and the cystocele. Enterocele is when the small bowel descends into the inguinal canal. In omentocele, the herniated part is the omentum, which is a large flat adipose tissue layer covering the surface of the abdominal organs. In cystocele, the bladder herniates into the inguinal canal. Now coming to the clinical type, which is widely used classification, we have the reducible hernia, which is a hernia with a bulge that flattens out when you lie down or push against it gently. In irreducible hernia, it is a hernia which resists manual pressure and cannot be pushed back into its place. The obstructed or incarcerated hernia is a lump or protruding part which is stuck and cannot go back into its original position. In strangulated hernia, it occurs when obstructed hernia is not treated. The blood supply to the protruding part is cut off as if it is strangulated, and it is an emergency condition requiring immediate treatment. The inflamed hernia is a hernia wherein the herniated part have inflamed due to any reasons.
The following signs and symptoms may occur with inguinal hernia. A bulge will appear on the affected side. There might be pain, especially on pressure or during exercise and coughing. Swelling might be present and patient may have fever in case of strangulated hernia. Inguinal nerve involvement can cause parasthesia, which is a tingling or pricking sensation in the lower limbs. Coming to the diagnostic test, a complete history will be taken and physical examination itself usually will reveal the bulge indicating hernia. Imaging studies like CT scan, MRI, ultrasound may be done to identify the content of the hernia and the extent of herniation. When it comes to treatment of hernia, an inguinal hernia will require some kind of surgical treatment for it, and the medical management only includes supportive treatment. Patient with reducible hernia may be kept under observation depending on extent of herniation, content of herniation, and other factors. Observation for complication of hernia like obstruction and strangulation will be looked out for, and such patients are then referred for emergency surgery of the hernia. There are basically three types of surgical options for hernia. The first option is herniotomy, which is removal of the hernial sac. In this, only the hernial sac is removed, and it is done exclusively for indirect inguinal hernia, which occurs in children. In children, the abdominal wall muscles are normal, and thus the removal of the hernial sac itself will treat the hernia. In herniorraphy, herniotomy along with repair of the posterior wall of the inguinal canal is done. In this, the surgeon cuts directly over the hernia and then accesses the displaced tissue or organ. This displaced tissue or organ is then replaced in its original position and the hernial sac is removed. The Bassini and Shouldice repairs are the example of a herniorraphy. This is a preferred surgery for young adults who have tighter muscles around the abdomen. The last option is hernioplasty, which is herniotomy plus reinforcement of the posterior wall of the inguinal canal with a synthetic mesh. The surgeon makes a small cut around the hole in the shape of the mesh and then stitches the patch into the healthy, intact surrounding tissues. The surgeon, instead of shutting the abdominal opening, covers it with a flat sterile mesh. This mesh acts as a support for the muscles. There are certain precautions one have to follow after hernial repair surgery. Do not lift heavy things for at least 2 weeks post-operatively. Do not engage in any activity which puts pressure on your stitches or increases abdominal pressure. Thus, avoid abdominal exercises, heavy weight lifting, etc. Avoid smoking and alcohol. Place your hand on the abdomen to provide support to it while coughing or sneezing. You can resume all normal activities like walking, climbing stairs, sexual activities after 48 hours of surgery. But if these activities put strain on the abdomen, then take rest. Ambulation helps with healing, and this is an important activity in the early postoperative days. For males, the scrotum might be slightly swollen or tender. This will go away with painkillers and ice application after some time. For diabetic patients, monitor your blood sugar levels regularly till the wound has healed. Also, maintain all dietary restrictions and maintain all therapeutic regimens for maintaining blood sugar levels within normal limits. You may be started on insulin as per requirements. Bowel movements may alter, causing diarrhea and the passage of gas for a few days. Avoid constipation as it increases strain and causes an increase in abdominal pressure. The bowel movements will return back to normal within few days. You can shower 36 to 48 hours after the surgery or as told by the doctor. You might observe seroma, which is the collection of fluid immediately after hernia repair, where the serous fluid may collect where the hernia was originally present. The fluid is automatically absorbed into the body in few days. Meet the doctor immediately if you develop fever, chills, pus in surgical site, nausea, increased pain, the stitches open, or if the wound is not healing. Thank you for watching. Please do like and subscribe my channel.